With the U.S. Supreme Court ending affirmative action in college admissions, there's growing concern about ways to achieve diversity on campuses nationwide.
And as our Candace Redd explains, critics say the decision threatens the diversity of the healthcare field.
For Eryn Reeder, diversity matters.
It is not uncommon to be the only in the room.
Reeder grew up in Sacramento. At a young age, she says she wanted to help others.
I wanted to be a pediatrician.
Reeder turned to higher education. She went to Xavier University of Louisiana in New Orleans. It's the only historically Black Catholic university in the U.S.
Xavier had the top placement of African Americans into medical school. It was just a really fun and supportive place to be. I did not end up graduating from there because of lots of things having to do with Hurricane Katrina.
Reeder left the HBCU and went to Cal State East Bay in Hayward.
The level of support was not the same.
Despite challenges, she earned a bachelor's in English and master's in social work.
It took a lot of additional resourcing, right? And a lot of self-advocacy to get the help and support that was needed. And I think it's a different experience, right? When you feel like the institution that you are going to really wants you to be there.
Reeder says she eventually became a therapist to help fill a need.
I hear over and over and over, it's so hard to find a Black therapist. It's so hard to find a therapist who's not white.
They should not abandon their commitment to ensure student bodies of diverse backgrounds.
With the U.S. Supreme Court ending affirmative action in college admissions, Reeder's concerned about the lack of diversity in healthcare and what that could possibly mean for Black communities.
We're still fighting the idea that mental health care is for white people. So there's so much stigma that we're trying to overcome just to get somebody into the room. And then it's so often that people get into the room and still feel discriminated against, still feel misunderstood.
The American Psychiatric Association is concerned too. The APA released this statement reading in part, the Supreme Court's decision undermines the ability of colleges, universities, and medical schools to build a workforce of healthcare professionals that can effectively treat the increasingly diverse body of patients they serve.
The reality is that there already are not a lot of Black people or a lot of people of color in the room.
According to the APA, white people make up the majority of physicians in the U.S. with 63%. Asian Americans account for 20%, Hispanics make up 6%, Black people stand at 5%, and Native Americans represent less than 1%.
My hope is that there will be institutions and organizations that step up.
The American Psychiatric Association says affirmative action in college admissions is, quote, an effective tool in assembling a diverse mental health workforce. The association goes on to explain diversity is critical to providing quality mental health care for all and addressing the mental health inequities that marginalized people experience.